Hey, welcome. Today we're going to talk all about the VA foot exam for disability benefits. And, most importantly, we're going to walk through how you can get ready for it.
Our goal here is really just to guide you through this, step by step. That way, when the time comes, you can walk into that exam feeling totally confident and prepared. So here's what we've got on tap. We'll start with the most important document for your exam, the DBQ. Then we'll dive into some common foot conditions, talk about how to get your evidence ready, what actually happens during the exam, and we'll wrap up with the best mindset to have going in. All right, first things first, let's talk about the absolute foundation of your exam, the Disability Benefits Questionnaire. You'll hear it called the DBQ. So what is a DBQ? Well, it's just the standard government form that the examiner uses to write down everything about your condition. Think of it like a roadmap for the entire exam. It's a few pages long, and it really structures the whole appointment. And how long does this take? Usually, you can expect the whole thing to be about 30 minutes. It's just good to know that going in, right? Helps you set your expectations. Okay, now this is really, really important. The whole point of the CNP exam is to capture what you look like on a bad day. It's not about how you feel when things are going great. It's about when your foot condition is at its worst. Keep that in mind through this whole process. So, keeping that idea of a bad day in mind, let's shift gears and talk about some of the common foot conditions that veterans deal with. Knowing your diagnosis is a big piece of the puzzle. Our feet are just incredibly complex. They're packed with all these tiny bones, joints, ligaments, tendons, and nerves. And because they're so complex, a problem in just one little spot can cause all sorts of issues: pain, numbness, weakness that you feel all over. Okay, let's start with a really common one, plantar fasciitis. This is when that thick band of tissue on the bottom of your foot, the one that connects your heel to your toes, gets all inflamed and painful. So if you've got this, these symptoms probably sound familiar. You might have pain in the arch of your foot, maybe some swelling around your heel, and of course there's that sharp stabbing pain in your heel. All right, next up is something called pes planus. You probably know it as flat feet. And you can really see the difference here, can't you? On one side, there's a normal arch. On the other, the arch has collapsed and the whole bottom of the foot is pretty much touching the ground. And here's another one you might recognize, hallux valgus, which is just the medical term for a bunion. It's that bony bump that forms right at the base of your big toe. The difference is pretty clear when you see it next to a foot without one. Now, what about a hammer toe? Well, that happens when the middle joint of one of your toes gets stuck in this bent position. Instead of lying flat, it kind of curls down, and it often looks like a little upside-down V. This picture here shows exactly what's happening to that joint. Last one for this section is Morton's neuroma. And just to be clear, this is not a tumor. It's where the tissue around a nerve in your foot gets thick, usually between your third and fourth toes. A lot of people say it feels like you're stepping on a marble or a pebble all the time, and it can cause this sharp, burning pain. Okay, so now that we've covered some of those common conditions, let's get into the really practical stuff, what you need to do to prepare your evidence before you even walk in the door for your exam. There are really three main things you can do. Number one, get all your evidence submitted to the VA Evidence Intake Center way ahead of time. Number two, make sure you include a personal statement that describes your symptoms, along with things like X-ray or MRI reports. And number three, go get your private medical records yourself. And that last point is huge. I can't stress this enough. Don't just rely on the VA to get those private records. Be your own advocate. Go get them yourself. That's the only way to be sure they're in your file and that the examiner will actually see them. Okay, so this question comes up all the time. What if you wake up on the day of your exam and you feel okay? Even if your symptoms are better that day, you have to describe what your limitations are on your worst days. You have to talk about the flare-ups. All right, so you've done all your prep work, you're ready to go. Now let's talk about what actually happens during the exam. We'll start with the medical history part. The examiner is going to ask you a bunch of questions about your history, so be ready to talk about it. How did this all start? How has it progressed? What are your symptoms like right now? Any pain, numbness, or tingling? How does it affect your job? Be specific.
And definitely be ready to talk about those flare-ups, what triggers them, how often they pop up, how long they stick around. Oh, and it's a good idea to have a list of your meds, any surgery dates, and any devices you use, like orthotics, special shoes, or even a cane. The examiner should ask about all this, but it's great to have your answers ready. Okay, after you've talked through your history, there's the physical exam. This part is usually pretty straightforward, nothing to worry about. The examiner will probably inspect your feet and ankles. They might press on different spots to see what hurts, maybe test the feeling in your feet, and they should definitely watch you walk to see how you move. Okay, let's wrap up with something that's just as important as all the paperwork and preparation, your mindset. How you approach this appointment really matters. You got to remember why you're there. This isn't a normal doctor's visit. You're not there to get a diagnosis or a new prescription. You are there for one reason, to tell your story, to report the facts about your condition and exactly how it impacts your life. So if it all feels like a lot, just boil it down to these 3 things. Be respectful, be honest, and be prepared. That's it. Respectful, honest, and prepared. At the end of the day, nobody knows what you're going through better than you. You are the expert on your own experience.
Now let's transition into the rating formula for foot conditions. We will revisit some of the foot conditions we discussed earlier.
Okay, first up, plantar fasciitis. You know that awful stabbing pain in your heel? That's the one. Now look at this. The ratings really depend on if treatment works and if it's one or both feet. All right, next is acquired flat foot or pes planus. This is when the arch falls. Let's see the grades. As you can see, it's all about severity. The rating can go from 0 all the way up to 50%. Claw foot or pes cavus is a thigh arch. Now, how does that get rated? Just like flat foot, the rating here boils down to how severe the condition is. Okay, let's switch gears to toes. First up, hallux valgus. You probably know them as bunions. If it's severe or if you've had surgery on that joint, it's a pretty straightforward 10% rating. Related to that is hallux rigidus. Think of it as arthritis giving you a stiff big toe. And the rating? Super simple. It's rated the exact same way as the bunions we just saw. Another common one is hammer toe. This is when a toe gets stuck in that bent, downward position. Now here's the catch. You only get a 10% rating if all the toes on one foot are affected. So what about other stuff? Like, say, a fracture that didn't heal right. Yep, there's a rating for that too. For these, it's a scale from moderate to severe. And there's a special note for total loss of use.
Like this video if it helped you. Hit subscribe for more disability exam prep content. Send this to a veteran who has a C&P exam coming up. Check out valorforvet.com for more resources. See how the team of medical experts at Valor for Vet may be able to help with your VA disability claim.